Outside In is a medical clinic and social service agency. We focus on serving homeless and very low-income people.
Outside In's clinic's mission is to find the people in Portland who are the most vulnerable, who are falling through the cracks, who are not getting health care, and whose lives are out of control, and help them lead healthy lives.
The clinic has been the one constant at Outside In since 1968 because there is not universal health care in this country. And people get sick and absolutely need access to health care. And we've made it a priority to be open and available for them.
When we first started, we did a lot of work with hippies, with a city that didn't know how to deal with it. Now, 40 years later, we work a lot with homeless youth, homeless Iraqi war veterans, sex workers, day laborers. We're even in school-based health centers. People that live on the streets have many problems. They might have a chronic mental illness. They might have a substance abuse problem. You might be having survival sex, and you're vulnerable to sexually transmitted diseases or pregnancy.
Homeless and low-income individuals have all the same health issues that everyone else in society has. The main issue is they don't have access to care. So as a result, things that could be treated more efficiently earlier on become more chronic in nature.
You have to address their whole living situation. A person that is homeless and sleeping outside and being rained on can't recover from the flu because their immune system is compromised, they're challenged. Housing becomes a medical intervention. Food becomes a medical intervention. Dry socks becomes as important as penicillin.
The comprehensive nature of the services it provides is fairly unique. It not only provides primary care, but a mix of allopathic and naturopathic care. It provides acupuncture and Chinese herbal medicine, the tattoo removal. It has a van that takes medical care to where people are, whether it be Dignity Village, the day labor camp, or Southeast 82nd.
We work with the individual to address the wraparound needs that they might have. We have a very strong mental health and addictions program here, which is a large portion of the homeless people that we serve. Another thing is that we have a very strong health access program that works to get people enrolled in whatever entitlements they might be eligible for, whether it's Medicaid, the Oregon Health Plan, or SSI, or medical housing. We have people that will help them get through the bureaucratic red tape that stands in the way.
A major accomplishment of Outside In was starting the syringe exchange program in 1989. Unfortunately, it was very controversial at that time, but we took that on as an issue and really fought hard in this community to be able to do that because we believed it was the best thing for our clients.
Our difficulties are twofold. We have a constant pressure from the clients that we serve to increase, to see more patients, to not turn them away. And then right up against that is funding. How do you pay for more? How do you expand more? Sometimes that's through raising revenue. Sometimes that's through organizing the community to see the need and to find a way to address the need.
The clinic at Outside In actually had a near-death experience. And what came out of that is the National College of Naturopathic Medicine said they would operate at Outside In as a teaching site and keep the doors open. 3 months later, Oregon Health Science University Hospital said, we also will operate at Outside In as a teaching site.
We can provide basic medical care, but we need help to try to meet those needs. So it takes a whole community to meet those health needs.
It's important to provide health care to low-income and homeless people because in this country, they need safety net clinics, such as Outside In, so that they can get that basic need met.
In Portland, there are currently about 350,000 people without medical insurance. Outside In's clients, 90% of them have no medical insurance. We are able to see people without health insurance because we tap into volunteers, we have a lot of community support, and then we also are able to work with foundations and government grants that target hard-to-serve people, and that's what we're good at.
We turn away a number of individuals every single day. So if Outside In wasn't available, even fewer individuals would receive the care that they need to. We're working now on expanding the clinic, building more rooms, more spaces so we can increase our capacity. We're also working to increase our efficiency in how we see individuals and provide those resources and referrals. We're also working on expanding the number of providers and the number of provider hours we have so that we can see more, provide better service, higher quality of care, and better meet the needs of our population.
Everywhere I go in Portland, when people find out I'm the director of Outside In, frequently they say, when I was a teenager, when I was in my 20s, I used Outside In's clinic. You were there for me. It's so amazing to me, the number of people that have gone through these doors and found help.
A measure of how great a society is how well they take care of their most vulnerable people. Outside In is working to reach out to those folks that are most vulnerable in our community. In Portland, there are a lot of people with needs that are not being met. Outside In is here to do that. This is our city. We need to take care of it.